clamping during the third stage of labor, which is the stage after the baby has been born and we're waiting for the placenta to be born. If your baby is born in a home birth or at a birth center, the decision about when to cut the cord is left up usually to the parents. And usually that decision is when the cord is stopped pulsing and it's flat 2 to 4 minutes after the baby has been born or until the placenta has been delivered. Hospitals tend to cut the cord at first opportunity, and there are some serious risks that go along with early cord clamping, which is right away, usually around 30 seconds after birth. It can lead to a retained placenta, postpartum hemorrhage, and respiratory distress in the newborn child. Early cord clamping also leads to fewer red blood cells in the baby. Delayed cord clamping is especially beneficial for premature babies. Judy Mercer did a 2006 study which showed that delayed cord clamping in babies born before 32 weeks helped prevent brain bleeds and infections. Delayed or physiological cord clamping is important because 20 to 50% of the baby's blood volume is still in the placenta at the time of birth. And delayed cord clamping and allowing that umbilical cord to flatten before it is cut allows for all of that blood or most of that blood volume to flow back into baby. So talking about that, here we have the placenta, which is still inside mom, inside of the uterus, and baby is still attached. And inside that placenta is 20 to 50% of the baby's blood volume. Now imagine cutting that off. I'll show you a little bit of a demonstration to show the actual blood volume. I'm going to give you a visual on how much blood is in between the placenta and the baby, and how much the baby loses if there is early cord clamping, and how much the baby gains if there is delayed cord clamping or physiological cord clamping. This bottle has 450 milliliters of blood, which is the approximate amount that the baby has between itself and the placenta at the time of birth. This bottle represents the blood that is still inside of the baby at the time of birth, and this bottle represents the blood volume that is left inside of the placenta at the time of birth. So as long as the cord is intact and pulsing, the placenta is draining into the baby, and the baby is able to get more blood to oxygenate his or her lungs and to lower the risk of anemia, and the baby is allowed to benefit. So that is what we want. So delayed cord clamping also allows time for skin to skin between mom and baby. The mother's body and the mother's chest is a perfect warmer for baby. And cutting that cord early allows for the baby to be whisked away from mom instead of just placed on her chest where he needs to be warmed, for that oxytocin to flow over mom, the bonding to begin, and the prolactin to start so that to facilitate breastfeeding. That golden hour is so important, and so allowing that cord to be intact and giving mom and baby time skin to skin is very important. The baby is less likely to suffer from anemia if the cord is left intact. Some people bring up cord blood banking when talking about delayed cord clamping. You really can't bank your cord blood if you are going to do delayed cord clamping. But before you make those decisions, you really need to consider the effects on your baby right now. What does the American Academy of Pediatrics say about it? It calls it unethical and that it should be discouraged. It's interesting that some people talk about cord blood banking being cited as a treatment for autism when really experts are starting to find that early cord clamping might attribute to autism. When you think about how much blood a baby loses when you do early cord clamping, it can be for anywhere from 100 to 150 milliliters taken from the baby's supply. And that is equivalent to 3.5 pints of blood from an adult, which is 3 to 4 times the volume of an adult donation. That's how much your newborn baby is losing when you cut that cord early. In Sarah Buckley's Gentle Birth, Gentle Mothering, she discusses lotus birth a little bit, and that is another option or an alternative that you have to clamping and cutting the cord at all. You don't have to cut the cord at all. It's sort of, if you look at the brains model, benefits, risks, alternatives. Alternative is lotus birth. It's when the placenta remains attached to the baby. I've watched some videos where they've taken the placenta and put it in a bowl of ice or in some herbs to keep it cured until the cord separates naturally over several days, which is about the same amount of time that it would take for the stump to fall off when the cord is cut. What lotus birth does for mom and baby is it, like a midwife, it secludes mother and baby in the early hours and days, ensuring rest and keeping visitors to a minimum. So if that doesn't sound good to you as a new mom, then I don't know what does. I'm going to give you a little bit of information about why the cord blood is so important to the newborn baby. It has neurotrophins, and it protects brain cells from death related to oxygen deprivation. And it helps repair brain cell damage as well. Epithelial progenitor cells, they repair damaged tissue, and they produce new blood vessels as well. And the stimulation of vascular endothelial growth factor, VEGF, by stem cells. It protects the brain cells. And it also allows the formation of glial cells and astrocytes from stem cells to repair damage to white matter in the brain. And it helps protect from cerebral palsy. So those benefits alone should give you good reason to ask for those few more minutes. Those couple of minutes will not hurt your baby. It'll help your baby. And as a parent, I'm sure that if you know those first decisions you can make for your child, if one of those decisions is going to help, then I'm sure that you'll make those good decisions. A book for midwives says to wait for cord cutting. When the baby is born, the cord is fat and blue, like this. When the baby is born, the cord is fat and blue. And it's actually more blue looking than this. It helps the baby have more iron in his blood and help keep baby where he or she belongs, which is, again, right on the chest. If you touch it with your finger, you'll feel it pulsing. And when the placenta separates from the wall of the womb, the cord will get thin and stop pulsing. And it's usually about 3 minutes, or even better, waiting until the placenta has delivered. Also, the draining of that placenta allows for the placenta to kind of become smaller to help facilitate the birth of that placenta. In history, early cord clamping was done because of the concern for jaundice, but it does not increase at all or significantly, maybe by 1 or 2% based on one study. As long as the cord is intact and the blood and it's still pulsing, the baby keeps receiving oxygen via cord blood. And it allows for optimal respiration because of the increased blood circulating to the baby's lungs. Iron stores increase by 45%, and anemia is less likely up to 6 months of age. There are some exceptions for delayed cord clamping or physiological cord clamping. And that is if the baby needs immediate medical attention, or the mom needs immediate medical attention. Their life is at risk, prematurity, or breathing in a lot of meconium. And also, Penny Simkin talks about even if resuscitation needs to be done, it can still be done on mommy's chest, and it allows for more blood flow to the lungs to leave that cord intact. You don't need to cut it right away. That some of those resuscitation procedures can be done right on mom. So another is low APGAR score. Cord is wrapped very tightly around the baby's neck, and it's preventing delivery, so that cord needs to be cut early on. And those are some of the exceptions for delayed cord clamping. So that is what I wanted to talk about today. Some of the sources that I used for my information are IMA's Guide to Childbirth, Gentle Birth, Gentle Mothering by Sarah J. Buckley, The Birth Partner by Penny Simkin, and A Book for Midwives. And this is by Susan Klein, Sue Ellen Miller, and Fiona Thompson. And also the Penny Simkin video on delayed cord clamping. We will see you later. Thanks. Oh, Keep that cord intact. Hi, everybody.